Hello everyone. Very good morning to all of you. And this is Neha Singh. We will discuss about myocardial infarctions. Okay. So what are the myocardial infarctions all about? The causes of myocardial infarctions and what could be the risk factor of myocardial infarctions and what are the sign and symptoms of myocardial infarctions, and we will all about discuss myocardial infarctions. So what is myocardial infarctions? It is a medical emergency condition. It is cardiovascular disease. Okay, and so we will discuss firstly about introduction of myocardial infarction. Okay, so we will discuss these topics about myocardial infarctions. Firstly is introduction of myocardial infarctions, what could be the causes and what could be the risk factor of myocardial infarctions, and clinical manifestations, diagnostic evaluation, management of myocardial infarctions, whether it is a pharmacological management, and next one is surgical management. Okay. So pharmacological management and surgical management is equally mainly role play in recovery of myocardial infarctions. Okay. So lastly, we will discuss about what are the complications of myocardial infarctions. So, guys, first one is introductions. Okay. So look, introduction of myocardial infarction. So it refers to the process by which myocardial tissues are permanently destroyed in the region of heart that deprived of on adequate supply of blood. A myocardial ischemia because of reduced coronary blood flow, subsequently necrosis or death of myocardial tissues occurs. Okay, so it means myocardial disease is a disease of heart, and myocardial is a middle layer of heart. So it is mainly main layer of heart because it causes the contraction and relaxation of heart. So this disease, if any necrosis and ischemia is caused, the myocardial layer of heart. So this disease is caused in myocardial muscles. Okay. So this disease is caused by the decreased blood flow of heart. So heart receive blood to the functional or proper workly of heart by the coronary artery. So coronary arteries is main role play in to supply the blood to the heart. Okay. So it is also the imbalance between decreased O2 supply and increased oxygen demand. So myocardial infarction is a disease which is imbalance between decreased O2 supply and increased oxygen demand. When the patient is having the myocardial infarction, but this disease is caused also the when the patient is having decreased oxygen supply and the heart is need more than oxygen. Okay. So due to the decreased blood flow, and the heart can't receive enough blood flow and enough oxygen, so it can't properly or adequate amount of oxygen or blood supply to the myocardial muscles or cells. So when myocardial cells can't receive enough blood or enough oxygen, so in these cells is start anaerobic respiration because of if oxygen is not supply enough or oxygen is not adequately amount is enough, so these cells is start the anaerobic respiration. When anaerobic respiration is start, and this areas is develop the lactic acid. Because of this lactic acid is also cause the pain. When the patient is having myocardial infarction disease, so the patient is having the severe chest pain. It is also called the MI. Okay, and it is also called the heart attack. So when the patient is having heart attack, then patient is feel severe chest pain due to the decreased oxygen supply to the myocardial cells. And myocardial cells is start the anaerobic respiration. Anaerobic respiration is also known as this respiration is start in the absence of oxygen. Okay, so absence of oxygen, so lactic acid form, and this lactic acid cause the pain. So the patient is feel the severe pain. Okay. So this is all about introductions of myocardial infarction. And look this image. This image, the base of heart is the base of heart. Uh, there is some minor location is look like a bluish discoloration due to the ischemia and decrease auto supply. Okay, so this discoloration is denote the and indicate that decrease auto supply in this particularly area. So this myocardial because and look this image, this embolism and thrombus is also present in coronary arteries, which cause the obstruction in blood flow of coronary arteries. Okay, so this is all about the introduction of myocardial infarctions. So next, discuss about causes. The causes of myocardial infarction. The firstly and more important causes of myocardial infarction is atherosclerosis. So, what is atherosclerosis? Briefly, we will discuss about. And firstly, we will only enlist the causes of myocardial infarction. First one is atherosclerosis. Okay. Second one is thrombus or embolus. Third one is embolus in any other sites. Fourth one is vasospasm. And next one is hemorrhage and anemia. And next one is severe pulmonary diseases. Okay. So last one is cyanotic heart disease. Now we will discuss about briefly one by one what are the causes, how cause the myocardial infarction, and how cause the obstruction in coronary artery blood flow. Okay. So first one is atherosclerosis. Okay. So atherosclerosis is a medical conditions in which the fat and lipid in deposition of inner lining of coronary arteries, and we can say in another way, fat and lipid is accumulation in tunica intima of coronary arteries. Okay, so it can cause the obstruction in blood flow of coronary arteries, and so can't supply the enough blood and enough oxygen to the heart, and finally it leads to the ischemia or necrosis in myocardial muscles or myocardial cells. Okay, so next one is that discuss about atherosclerosis. It leads ischemia. Okay, so ischemia is a main important things to cause the myocardial infarctions. So uh, ischemia traits as major role playing cause of myocardial infarction. So we will see and what are the condition in role play in ischemia trait. Okay, so first one is decrease oxygen supply. If oxygen supply is decreased, then myocardial cells are can't receive enough blood flow and enough oxygen. Okay, so cells can necrose after a long time. Okay, so second one is decrease pass out of metabolism, metabolic waste. If myocardial if myocardial muscles can't pass out metabolic waste, if metabolic waste and more than accumulated in heart, or we can say myocardial muscles or tissues, so it can also lead the necrosis in tissue because the metabolic waste is a waste material. So cell can't receive these metabolic waste to grow and for life. Okay, So third one is decrease other nutrients. If myocardial cells have not enough nutrients, it also cause the necrosis. Okay, so these factor are ischemia trait, and these are very dangerous. Okay, so these are very dangerous if these conditions are not fulfilled. Okay, so these condition if not recover, then it is cause the severe myocardial infarction or severe necrosis or ischemia. Okay, so we will see causes of ischemia, how to cause ischemia in heart. Okay, so first one is ischemic heart diseases. How to cause? First one is right. We will see right-sided of heart. What are the causes of right-sided of heart, and what are the causes of left-sided of heart? So right-sided of ventricles. Okay. So these are causes. The first one is wall thickness 0.3 to 0.5 centimeter. Okay. So right ventricle wall thickness have 0.3 to 0.5%. Okay. So it is less thickness. Okay. And decrease O2 need. So right ventricle have not increase O2 need. It has decrease O2 need, and the next one is decrease tension in right ventricular wall. So these are a factor which is a minor cause the ischemia. So left ventricle wall thickness 1.5 centimeter, and next one is increase O2 demand, and left ventricle have increased O2 demand and increased tension in left ventricle. When left ventricle is particularly and automatically constrict and contraction of blood, and which supply the all part of body, so it have lot of work, lot of demand, and lot of tensions. So it will is a very much vulnerable for the ischemia or necrosis, because it have lot of work, lot of demand of O2, and lot of tensions to contractions of blood flow. Okay, these are the causes of ischemia. Got it? These are the causes of ischemia. And we will see next classification of MI. What are the classifications of MI? According to different areas of MI. The first one is according to degree of damage. Okay. So how many degree of damage which cause the MI? So first one is zone of infarctions. Okay. So zone of infarctions, in this condition dead of heart muscles completely and O2 deprivations. In this condition, the heart muscles and heart tissues are completely dead. Okay, this is known as zone of infractions. Okay, so this inner circle is denote of zone of infraction and necrosis. When the tissues are completely dead and necrosis, this zone is known as zone of infractions. Okay, so look, second, zone of injury. So the muscle surroundings of necrosis injured still viable. Okay. So next is circle. Next half circle line is denote the zone of injury. The zone of injury is surrounding area of necrosis, but it is not completely dead. Okay. So it's not completely dead, and because of and it have impaired functions and not properly birth, but it is viable. Viable means if oxygen supply and O2 supply is resupply to these areas, it can recover and it can restart these functions properly and normally. Okay. So this second lining area is denote the zone of injury. Okay. So next one is zone of ischemia. Zone of ischemia is muscles surrounding or of injury, ischemia and bival. Okay. So zone of ischemia is known as outer. It is surrounding area of zone of injury. So it is surrounding area of zone of injury, and it is also not completely dead, and these cells or tissues are not completely dead, only is these are injured, and these are a bival matlab it means it do not do properly work and properly function. But if treatment is start and oxygen supply and blood supply is resupplied to this area, it can recover and it can restart the proper work. Okay. So these are the according to degree of damage. It is myocardial infarction according to degree of damage. So three types of degree which cause the myocardial infarction. Okay, got it. So next classification. So next classification is according to layer of heart muscles involved. So, layer of heart muscles, how to involve and how to cause a myocardial infarction. So, and how to cause this severe diseases. Okay. So, first one is transmural infractions. Okay. Transmural infraction, it is also known as ST segment elevation of MI. Okay. So, involve full thickness of heart, complete obstruction of coronary arteries, and this condition is also cause of the full obstruction of coronary arteries. When coronary arteries had completely obstructed blood flow, and that condition it lead to transmural infection. Okay. So in ECG, the patient is having transmural infection. In this ECG, is ST segment is elevated. Okay. So in this ECG, we look these pictures. ST segment elevated. Okay. So ST segment P Q R S T. ST segment is very elevated. Okay. So, in these conditions, ST segment is elevated. Now, next one is another classification. Okay. So, next one is subendocardial or non-transmural infection. The second one is endo subendocardial and non-transmural infractions. It is also known as non-ST segment elevation of MI. So, involve small area in the endocardial wall of the left ventricle and ventricular septal or papillary muscles. In these conditions, it's involved the small area of endocardial valve of left ventricle. Okay. So in this condition, not completely inner valve of heart, it is only involved in left ventricle inner lining, which is called the endocardial. Okay. And it is also involved ventricular septal. Ventricular septal is a part between two ventricles, okay, and papillary muscles. Okay, so these are small area involved in this MI, and we will see ECG. Look, this is normal ECG, and this is ST depressed ECG, and we will see when ST depression ECG P Q R S T. This is ST elevation, ST depressed area. So look this picture and these conditions ST depression show in ECG. Okay. So this condition is caused in subendocardial non-transmural infractions. Okay. So these are totally classifications of myocardial infarction. Now we will see another classification of myocardial infarction. So first one is according to classification on the basis of location of myocardial involves myocardial muscles involved. Okay, so what are the classification? Heart muscles involved. How many layer of heart on how many muscles of heart involved? These types of myocardial infarction. The first one is LADA. Okay, so LADA is left anterior descending artery. Okay, left anterior descending artery. Okay, obstruction in left atrium descending arteries results in anterior or septal wall MI. If left anterior descending artery is involved, and in this arteries if necrosis or ischemia is caused, and this ischemia is caused the anterior or septal wall MI. Okay, so if LADA is, it is most commonly MI. Okay, it is most commonly MI, and most person is having this type of MI. And MI is not caused less than 40 years of age, because it's a um, cause the 40 years of age, and after that 40 years of age. So next one is circumflex artery. Okay, so circumflex arteries result in posterior wall MI. If the necrosis and ischemia is involved in circumflex artery, so results in posterior wall MI. If this artery infracted, and it caused the posterior wall MI. So next one is right coronary arteries. Okay, so right coronary arteries is infracted, and its result in inferior wall MI. Okay, sorry, this is MI. Okay, so this is MI. Okay, so this is all about classification of myocardial infarction, and different based on areas, location or muscles involved, okay, of heart. So this is all about classifications of myocardial infarctions. Okay, so we will next discuss about the risk factor. Okay, what could be the risk factor of myocardial infarction? So now we will see main role of causes which cause the disease, but risk factor are also 50% role playing cause the disease. Okay, so there are two categories of risk factor. First one is modifiable risk factor, and second one is non-modifiable risk factor. Okay, modifiable risk factor means of we can change and we can modify these risk factor. Okay, and we can change in our lifestyle, and we can modify it in our lifestyle and prevent this disease. Okay, and see a non-modifiable risk factor which are can't change, it is hereditary and by birth. Okay, so first one is modifiable. Okay, what are the modifiable risk factor? First one is high blood lipid level. If blood lipid level is high, then it is caused the obstruction in blood flow. When obstruction in blood flow is caused, it's not supply proper blood flow to the myocardial muscles or tissues, and these can't receive enough O2 supply. It finally leads to necrosis and ischemia. Okay, then second is smoking. Okay, so smoking is main role play in myocardial infarctions. Okay, how cause the myocardial infarctions? Okay, so smoking is cause the severe vasoconstriction in a person. When the if any person is a smoker and severe smoker, then when is smoking, and it is cause the severe vasoconstriction in blood vessels, and when vasoconstriction in cause, then enough blood supply to the heart, and heart can't receive enough blood supply and O2, it is finally leads to necrosis and ischemia. Okay, so alcohol is also cause the ischemia and necrosis, and hypertension. Hypertension and obesity, these are major risk factor. If the patient is having hypertension, is obesity, so these patient in vulnerable or risk in to develop the myocardial infarctions. Okay. So lack of estrogen in women. Okay. So if the patient, if any woman is having menopause and this estrogen is lack in condition in menopause, okay. So menopause in cause the 40 or 45 years of age after that. So the woman is having lack of estrogen due to the menopause, and this condition is developed. So this woman is vulnerable or risk in to develop this myocardial infarctions. Okay. So diabetes mellitus is also cause and major risk factor to develop myocardial infarctions. Okay, and educate physical activity. If the patient is having educate physical activity, so this patient is a risk for developing myocardial infarction. So when we will discuss on manifestation and management and pathophysiology of myocardial infarction, and all of you got it briefly this risk factor. Okay, so we will discuss about non-modifiable risk factor. Non-modifiable risk factor we can't change and we can't modify. The first is family history. If family history having myocardial infarction, and previously if mother and grandmother, grandfather and father is having previously myocardial infarction, then their child is also vulnerable and risk for develop myocardial infarction. The second one is age. I already told you the 40 years of age, and after the 40 years of age this condition is developed. Okay. So gender in this, the MI or myocardial infarction is more developed in male than the female, because of the male is highly highly using of smoking, alcohol, and so it is also risk for develop myocardial infarctions. Okay. And the female is a decreased risk for, because of the female is having estrogen or menses regularly. So these menses blood is having plasmogen. So this plasmogen is converted into plasmin. This plasmin is dissolved in the thrombus and it can't clot the blood. It can't clot the blood. So the female is decreased risk for develop in myocardial infarctions. Okay. So next last one is autoimmune diseases. When autoimmune diseases, when this is also caused by the genetically. Okay, so we can change in genetically risk factor. If any patient is having autoimmune diseases, with when bleeding disorders is also an autoimmune diseases cause the patient is if the bleeding disorder and if clotting disorder, these can if these can cause the thrombus and embolus. So these patient is having the risk for the develop myocardial infarction. So all about the risk factor of myocardial infarction. So today we already look and discussed about introduction, causes, and all about classifications of myocardial infarction, and these are the risk factor infraction. Risk risk factor of infection. So next class we will discuss further discussion of myocardial infarction. So thank you.